Pancreatic cancer is a serious and often aggressive type of cancer that affects the pancreas, a gland located behind the stomach that produces hormones and enzymes that help the body digest food. Unfortunately, pancreatic cancer can be difficult to detect in its early stages. However, there are some signs and symptoms that you should be aware of that may indicate the presence of pancreatic cancer. In this video, we will discuss 12 signs of pancreatic cancer that you should not ignore. Before we begin, make sure you subscribe to our channel and press the bell icon to get regular updates. Let's get started. Number 1. Jaundice. Jaundice is a condition where the skin and eyes turn yellow. It can happen when someone has pancreatic cancer. Normally, the liver removes a yellow substance called bilirubin from the blood. But if there's a tumor near the bile ducts, it can stop this from happening. Then, bilirubin builds up in the blood and makes the skin and eyes yellow. If you see your skin or eyes turning yellow, it's important to see a doctor right away. This could be a sign of something serious, like pancreatic cancer. Getting medical help early is crucial. Number 2. Back pain. Persistent back pain, especially in the mid to upper spine, can be a sign of something serious like pancreatic cancer. The pancreas sits close to the spine, and as tumors grow, they can press on nearby nerves, causing pain. These nerves are important for carrying signals between the brain and the rest of the body. Sometimes the cancer can even spread into the spine itself, causing more pain. While there are many reasons for temporary back pain, if it persists without explanation, it's important to see a doctor for evaluation. Number 3. Sudden loss of appetite. A sudden loss of appetite or feeling full quickly after eating small amounts, known as early satiety, may be signs of pancreatic cancer. As tumors develop in the pancreas, they can press on nearby organs like the stomach and intestines, which play roles in digesting food and controlling hunger. This pressure can block important nerves and hormones that regulate appetite, leading to a decreased desire for food. Additionally, cancer cells can release chemicals that further suppress hunger. Furthermore, the tumors consume calories and nutrients that would normally nourish the body's cells, exacerbating the problem. Consequently, appetite significantly decreases, and food intake becomes limited, potentially resulting in weight loss. These symptoms highlight potential concerns that should be discussed with a healthcare provider. Number 4. Itchy skin. Itchy skin can be a symptom of high levels of bilirubin, which are caused by pancreatic tumors. Crystals of bilirubin can build up under the skin, leading to intense itching sensations even when there's no visible rash. This itching often starts on the palms of the hands and soles of the feet, which are very sensitive areas, but it can spread all over the body as the bilirubin levels rise. The eyes may also become itchy and watery. While mild itching can be triggered by many factors and might not be a cause for concern, persistent and severe skin irritation should be evaluated by a healthcare professional as it could indicate underlying obstructive jaundice. Number 5. Diabetes. The sudden appearance of diabetes can sometimes indicate an underlying pancreatic cancer. The pancreas is important for managing blood sugar levels by releasing insulin and glucagon hormones. Insulin lowers blood sugar, while glucagon raises it, maintaining the right sugar levels. However, when tumors grow in the pancreas, they disrupt the secretion of these hormones, leading to high blood sugar, known as diabetes. Number 6. Fatigue. Fatigue, or feeling extremely tired, can sometimes indicate problems with the pancreas. When the pancreas develops tumors, these abnormal growths can sap the body's energy resources. This draining effect happens because tumors interfere with the normal functioning of healthy tissue. Consequently, individuals may experience persistent fatigue as their bodies struggle to cope with the demands of both the tumors and normal bodily functions. Moreover, pancreatic tumors can disrupt the production of red blood cells. These cells carry oxygen throughout the body, including to muscles. When there's a shortage of red blood cells, muscles may not receive enough oxygen, leading to muscle fatigue and weakness. Consequently, Once easy tasks may become difficult or exhausting for individuals with pancreatic issues. Number 7. Changes in bowel movements. When someone notices changes in their bowel movements, it's important to pay attention. This is especially true for pancreatic cancer. If you have pancreatic cancer, your bowel movements might change. You might have diarrhea, which means going to the bathroom more often and having loose stools. Or you might have constipation, which means it's hard to go to the bathroom and your stools are hard. Number 8. Changes in urination. Pancreatic cancer can cause changes in how often you pee and how it feels when you do. It might make you pee more often than usual. You could feel like you need to pee all of a sudden, even if you didn't feel that way before. Sometimes you might feel pain or discomfort when you pee because of pancreatic cancer affecting your kidneys and urinary system. These changes can affect your daily life and how comfortable you feel. Dark urine is a common symptom of pancreatic cancer. When bile can't drain properly due to tumors, bilirubin builds up in the blood and seeps into the urine, making it darker. Number 9. Indigestion. Indigestion is when you feel a burning sensation in your chest and sometimes taste something unpleasant in your mouth. It's not a disease itself, but a symptom that something might be wrong. Sometimes it is just from eating too much or too fast, but other times it could be a sign of a more serious problem like pancreatic cancer. Pancreatic cancer is one of the more severe conditions that indigestion can be a symptom of. However, it's essential to understand that indigestion can also result from many other common issues. For instance, eating spicy or greasy foods, drinking too much alcohol, or even stress can trigger indigestion. Number 10. Unexpected weight loss. Unexpected weight loss can sometimes indicate a health issue, like pancreatic cancer. The pancreas does important jobs in our bodies, like helping with digestion and managing blood sugar. So when someone has pancreatic cancer, it can make them lose weight without trying. That is because cancer affects how the pancreas works, which can lead to weight loss even if the person hasn't changed his diet or exercise habits. If someone is losing weight without a clear reason, it's important to see a doctor to find out what might be causing it. Number 11. Light-colored stools. Light-colored stools can be a sign of pancreatic cancer. Normally, healthy stools are a brown color because of the pigment called bilirubin, which is released into the bile. However, when pancreatic tumors block the bile ducts, bilirubin can't reach the intestines properly. Without enough bilirubin, stools lose their usual brown color and become unusually pale. If your stools stay pale for a while, it's important to see a doctor. This change in stool color, especially when paired with symptoms like jaundice, yellowing of the skin and eyes, could indicate a medical issue. Number 12. Blood clots. Pancreatic cancer can cause blood clots to form in the body. This happens because tumors release substances that make the blood stickier than usual. As a result, red blood cells clump together, making the blood thicker. This increased stickiness also triggers the body's clotting mechanisms, leading to the formation of small clots in blood vessels. These clots can break loose and travel to the lungs, causing breathing problems. They can also narrow blood vessels in the legs, resulting in calf pain while walking. No matter which changes you notice, it's crucial to talk to a doctor. Sometimes, these changes can happen for reasons other than pancreatic cancer, but it's better to be safe and get checked by a doctor if you're not sure why these signs are occurring. They can help figure out what's causing the change and what you should do about it. That's all for now. Don't forget to like and share the video and follow us for more amazing content. Thanks for watching till the end.